Welcome to Rheumatoid Arthritis for Dummies. I'm Allie, and I'll be covering the first part of this video. For this first section, I'll be teaching you the basics of rheumatoid arthritis, which is also known as RA, like how it affects your body and what factors make you more likely to develop it. Let's get started. So, you might be asking yourself, what is rheumatoid arthritis? To put it simply, rheumatoid arthritis is an autoimmune disease that mainly impacts your joints. So how exactly does rheumatoid arthritis affect your body? Well, with autoimmune diseases like rheumatoid arthritis, your body mistakenly attacks itself and destroys healthy tissues. When your body attacks its healthy joint tissue, your joints begin to swell, leading to inflammation. This inflammation, over time, starts to degrade the cartilage and bones in your joints, which, as you can imagine, is not a pleasant experience. This brings us to our next question. Who is affected by rheumatoid arthritis? Well, according to the World Health Organization, rheumatoid arthritis affects an estimated 18 million people worldwide. Now, let's go over some of the risk factors for developing rheumatoid arthritis. One risk factor is age. People with RA generally report an onset of symptoms between the ages of 30 to 50, although you can develop the disease at any age. Another risk factor is your gender, with women being 2 to 3 times more likely to develop rheumatoid arthritis than men. Your family history also can impact your risk of developing RA. If someone in your family has RA or another autoimmune disease, you are at an increased risk of developing that disease as well. Other risk factors for RA that you have a little more control over are smoking and obesity or excessive weight. Well, that's it for your introduction. Now let's take a look at the signs and symptoms of rheumatoid arthritis.
Some signs and symptoms of RA. These symptoms include inflammation of the synovial fluid, fever, fatigue, and weight loss, symmetrical joint pain, stiffness, and swelling. The joints are going to look red and feel warm to the touch, and patients can also develop what's called our rheumatoid nodules. But most importantly, we want to focus on the pain. So patients who have RA are in a lot of pain, so we really want to focus on pain management. Here are some labs and diagnostics. There are 80% of patients who will be positive for a rheumatoid factor. There are antibodies, ESR rates, CRP, RBC and C4 decreased, anti-nuclear antibody, and RA can also be detected through an X-ray, an MRI, or an ultrasound.
Thank you, Christina, for those corny jokes. My name is Morgan, and I'll be going over treatments of rheumatoid arthritis with you. Goals of managing rheumatoid arthritis include symptom relief, especially pain management, preventing further joint damage, managing functional ability of the joint, and enhancing quality of life. With managing rheumatoid arthritis, there is both pharmacological treatments, which include nonsteroidal anti-inflammatory drugs, disease-modifying anti-rheumatic drugs, and corticosteroids. There's also non-pharmacological treatments to help with rheumatoid arthritis, like gentle exercise, physical therapy, and occupational therapy. And don't worry, I'll be explaining more in the next slides. Medication use for rheumatoid arthritis are nonsteroidal anti-inflammatory drugs, or NSAIDs for short, disease-modifying anti-rheumatic drugs, or DMARDs for short, and corticosteroids. NSAIDs like ibuprofen, Advil, and Motrin are great for quick pain relief. However, these medications do not help with preventing further joint damage that rheumatoid arthritis causes. There's also a risk for stomach problems with long-term use of these medications. Corticosteroids like prednisone relieve symptoms rapidly and prevent disease progression. However, these medications also aren't used for long-term use. DMARDs slows the disease progression and reduces joint damage, and a drug known as a DMARD is called methotrexate, and this is what you would call a gold standard medication. And what this means is that this is the first medication that a patient would be put on once diagnosed with rheumatoid arthritis, and this is ideally started within 3 months of diagnosis. Another example of a DMARD is also known as hydrochloroquine. Additional therapies include occupational therapy, physical therapy, range of motion exercises, isometric exercises, and aerobic exercises. Physical therapy helps improve movement and reduce pain by teaching patients how to exercise to strengthen the muscle and improve flexibility. They also help you create a personalized exercise program that fits your needs. Occupational therapy is a little different in the sense that they help you manage daily activities and maintain independence. They teach you strategies to make daily tasks easier, like dressing or cooking. They also help you develop a plan to conserve energy to avoid fatigue. With gentle exercises, there are multiple options like range of motion exercises, isometric exercises, and aerobic exercises. Range of motion exercises can include ankle circles or shoulder rolls, and these are great for improving mobility of the joint. Isometric exercises like squats or hand presses are great exercises for strengthening muscle and are low impact on the joints. Aerobic exercises like cycling, swimming, and walking are great for rheumatoid arthritis, especially swimming because it helps relieve stress off those joints. Lastly, applying heat packs to affected joints is helpful in reducing pain, muscle relaxation, and improving range of motion. With a combination of these medications and implementing gentle exercises and/or working with physical therapy and occupational therapy can make rheumatoid arthritis very manageable and overall improve your quality of life. On to you, Danny.
A key component to managing RA is to adhere to the follow-up regimen. This includes adhering to medication regimen in order to minimize flare-ups of symptoms and the risk of remission. Also, it is important to be following up regularly with a rheumatologist to monitor labs and imaging testing. This is important to monitor the progression of the disorder. Now, these are some community resources. There are resources online and in person to get more information on the disorder, as well as finding support groups near you. Room for More is an online website that has a wide range of resources, including check-ins as well as assisting to find a rheumatologist in your area. The Arthritis Foundation is another website where you can find support groups and connect you with people that also have RA. Lastly, there is the Program to Encourage Active, Rewarding Lives, also called PEARLS. This program provides sessions where a team member and you can collaborate together to meet goals, all from the comfort of your home.
And that's all we have. Thank you so much for listening to this presentation about rheumatoid arthritis for dummies.